Hi, everyone. Welcome. Hospice Nurse Julie here. Thank you for bearing with me. Um, I went live on YouTube a different day today, so welcome everybody. Come on in. And hi, everybody on TikTok. I'm not really going to be addressing you yet, but I am over on the tube that is you. I'm live over there if you want to come over and chat with us. It's also free. Welcome, everybody. Hi. Come on in. Come on in. Happy holidays, everyone. How's everyone doing? If you see me addressing the camera straight forward, that's me looking at the camera. If I start looking down, that's me looking at the chat. And remember, I usually will be live at 5 Pacific Standard Time every Thursday on YouTube. Every Thursday on YouTube. Welcome, everybody. Welcome, everyone on TikTok. How many years of schooling did you do? Well, I had a 4-year degree, my bachelor's degree in science in psychology, and then I went back and got my bachelor's degree in nursing, but in an accelerated nursing program. So it only took me 3 semesters, but it was wildly hard. So I have 2 bachelor's degree, one in nursing, one in psychology. Welcome, everybody. And for anyone who's new here, I'm a hospice nurse, Julia, educate about death and dying, and it's especially here on YouTube. TikTok, I know you're here too. Hello, I have 2 lives going right now. But on YouTube specifically, I'm trying to create a really great community, and so far it is working. So everyone in the chat is friendly to each other. We all support each other. We have a lot of regulars here, so I'm so grateful for that. Welcome, everyone. Hello from Ireland. Hi, Mary. Thank you, Michelle. Can you highlight the spiritual aspect of end of life? Sure. I mean, I do talk a lot about the different things that can happen at end of life that we can't really explain that could be taken as spiritual. I like to educate about them, not truly from a spiritual level because I am a nurse and I'm coming in from a different angle, but it's hard not to mesh the two because it does feel spiritual. So there are many deathbed phenomena that I talk about in my book, Nothing to Fear. It's chapter 6. It's the longest chapter that just seem to happen a lot at the end of life. I'm not the only one that says that. Anyone that works in the end of life knows that there's these things that happen, people talking to dead relatives, people seeing dead relatives, people seeing angels, people seeing God, hearing beautiful music. It's kind of like they're in one world and in our world and in another world. And as far as spirituality goes, um, as hospice workers, we stay out of it. If our patients want to talk to us about spirituality or religion, of course, we will go there with them if they want to and they ask us. But if they don't, we don't. And if anyone does, they are in the wrong. I think. I think. Okay, let's get to the chat again. Welcome everybody again. I'm hospice nurse Julie. In case you don't know, I usually go live at 5 every Thursday Pacific Standard Time on YouTube. And there's a great community we're growing here. So please ask your questions. Keep asking them. If I don't answer, ask them in all caps. And we'll go from there. When are we going to get universal health care in America? Yeah, tell me about it. Is it possible to live dignified lives in death in our lifetime? It's such a hard topic to talk about. I don't truly have the answer. Obviously, there's issues with universal health care as well, but insurance companies, healthcare for profit is the most insane thing ever. Not insane. Healthcare for profit is the most evil. Is evil. It is evil. And I don't even believe in evil. So what does that say? Maybe I do. Healthcare should not be for profit. Neither should prisons be for profit. I mean, that's the whole thing. So it's horrific. I don't have the answer. There are very caring people, caring, loving people working in a broken system, unfortunately. Thank you, Amy. Hi, everybody. Welcome. Jordan, thank you so much. At the end of life, people lose appetite for food. Do they also lose desire for tobacco and alcohol? They can, yes, they can. Even if even if they've smoked their whole lives and drank their whole life, like if they're dying an alcoholic death, like their liver fails, some people will, towards the end of life, very, very end of life, stop drinking and using tobacco, but not always. And now is not the time to make them quit. So I always say, smoke them if you got them, let them drink if they want to. As long as they are clean and safe and comfortable, we're good. Oh, thank you, Eric. Love your program so much. My dad, 98, passed July 9th this year. My mom, 92, passed October 20th. Wow. I wish I could put into words how much your channel helped me along with our home health care. Wow. Thank you, Eric. And thank you for being here. Thank you for helping us and sharing your story. And you helped your family by you being here. So I really appreciate you. And welcome all my TikTok followers. Hello. Yes, I'm live on TikTok as well. However, I'm not speaking to you guys directly. You are here to listen if you'd like, or I'm over on YouTube live right now. It's free if you want to check me out there. But you guys can listen too. Thank you for being here. I love you guys as well. Okay, when my brother passed, my sister and I saw green mist leave when he passed. I knew he was now out of pain and I felt a lot of relief from seeing it. Is it normal? I do not see green mist. I have not seen people always ask, have you seen someone's soul leave their body? Did you see a mist, whether it's green or clear or gray, whatever? And I don't see those things. I don't see those things. I do feel like sometimes I feel things, but I don't see things. But I would say it's common enough. I've heard that from many people. I don't know if they said it's green, but they've definitely have said mist. Now, the one thing I will say that's very common is people feeling relief when their loved one dies, specifically if they died from a long extended disease. They will feel relief once they're gone, and then they feel guilty for feeling relief. So it is very common for people to feel relief after their loved one has died. Hi, Julia. At what point do you remove a CPAP from a person dying who has sleep apnea, especially with severe sleep apnea, and they've used CPAP for years? Hi, Ginger. So I would always go by what the patient is saying and how they're feeling. Now, let's just say they can tell us, right? So I'd say as long as it's helping them and they're saying they want it and they're still alert and oriented enough to know that they want that, then we are all for it, specifically if it's causing them comfort, right? Now, towards the end, if they're fully unconscious and you could still have the CPAP on. However, it may be uncomfortable for them. So it just depends. Now, we don't really have to worry about a CPAP like making someone live longer or keeping them alive. When your body is fully shutting down like that, you are systematically, like every organ in your body is shutting down. So you could have a CPAP on there all day long. If the lungs aren't taking a breath, the lungs aren't taking a breath, right? So it's not really going to extend life. I do think once they're in the actively dying phase, which is the last phase of life where they're fully unconscious, I would take it off just because it might be a little uncomfortable for them. But generally speaking, it's a case by case basis. Work with your doctor, work with your nurses, and of course, listen to your loved one. So I hope that helps. We never have to really worry about like oxygen or something like CPAP keeping people alive. I've often even heard hospice nurses say stuff like, we remove the oxygen so we wouldn't prolong life. That's not really happening. The oxygen's not doing much. Most people, unless you are someone with severe lung issues who have lived on oxygen your whole life, it's not the oxygen that's the problem. It's the lungs that are not working. That's the problem. The lungs are not working as they should. It's nothing to do with not having enough oxygen. There are many things going on. So keeping the oxygen on, taking it off, it wouldn't really matter. No problem, Ginger. If you believe that you go to heaven, how many generations back do you go? And two animals also go to heaven. If so, they have generations of animals that go to heaven. Donna, I don't know. I don't know, girl. Is this thing on? Getting it closer to the mic. I don't know. I don't know. That is something I don't know. I do believe we go somewhere good when we die. Is it heaven? I mean, we can say heaven just so we just to make it easier, but who knows? Generations, I don't know. Donna says, sorry, silly question. It's not silly, it's okay. I just don't know. And we can talk amongst ourselves in the chat as long as we're all respectful people. Tell Donna what you think. What do you guys think? I think, quote unquote, heaven. And again, this is just my belief. It doesn't matter what I believe. What matters what you believe. Um, isn't thinking linear it's not lineal. So generations aren't thought about. I don't think time is there. I don't think it's something we don't fully understand. It's in a different dimension. Are we even physical beings, right? Is it just energy? I don't know. Thank you, Ramona. I hope I'm saying your name right. I have a question. My aunt had 3 strokes in the last 2 months. She's now in the hospital, not responsive. I believe she is actively dying. How can we look for signs? Thank you. I would, if you are in the hospital visiting her, I would ask doctors and nurses. I wouldn't say, is she actively dying? But I would say, and make sure they understand you're comfortable. You can say, I'm comfortable with whatever answer you give me. I'm just trying to understand, like, is my aunt close to death? What can we expect here? Now, they're not usually great or educated about end of life in the hospital. It's no fault of theirs. We're taught about how to keep people alive. So they may not fully understand, but I would generally say anyone who's fully unresponsive, not eating and drinking, which is okay, is getting close to the end of life. So sleeping 24 hours a day, not responsive, and not eating and drinking. That means they usually have like days to live if that's truly how they're going to, if they're not going to get a feeding tube or anything like that. Now, when they're getting very close to the end of life, in the actively dying phase, they're going to stay unresponsive, not eat and drink, again, very normal, and then slowly start having bodily changes. So changes in breathing, they're going to breathe different. Their eyes and mouths may be hanging open, but they're not making eye contact with you. They will have changes in skin color. They may have a little gurgling noise to their breath. All of those things are signals that the end is getting close, usually within a few days. Hope that helps. Hope that helps. Hey, Chrissy. If I haven't gotten to your question yet, feel free to ask it in all caps. Welcome, everybody, over on TikTok. Hi, I'm Hospice Nurse Julie. In case you don't know, I am live on YouTube and streaming here on TikTok. Please feel free to listen in or come over to YouTube if you want to ask some questions. Give me 1 second. Okay. Do you think they can hear us when they're gone? I do think they can hear us when they're gone. Now, they definitely can hear us while they're still alive, even if they're unconscious. So just know that. I have not switched my live sessions to Friday. No, they are normally Thursday at 5 p.m. However, I was going to miss this past Thursday and I didn't want to miss the live, so I just rescheduled it for today. Welcome, everybody. Curious Star, what obligations do the U.S. healthcare workers have to Palestine doctors, nurses, freedom fighters during the ongoing genocide? Just to be very transparent and honest, I have no idea. I think it's horrific, but I don't really want to speak of it because I don't know much about it. Is that bad or wrong of me? Maybe, especially you may think so. Definitely because you're asking. So I apologize if that hurts your heart that I am not more engaged in it. And just overall, I can't speak to it. I can't speak to it. Yes, we are obligated. Do I know anything about it? No. And I'm really sorry if that If that answer doesn't, yeah, if it hurts you. Okay. Can you see us tapping the hearts? Nathan, yes, I can see you tapping the hearts. Thank you. My loved one who passed on the 7th was between 1:30 and 1:50 the whole day while actively dying. Is that normal? Oh, the pulse. I would say that's a little elevated. I probably would medicate just because we don't want a super high heart rate. But I would say that's normal-ish. And generally speaking, when someone's on hospice, I wouldn't be taking their heart rate, blood pressure, or oxygen. I would just be going by how they look. But if we did see that, I would probably medicate. Is it totally necessary? No. But and it's normal. I mean, when someone's dying, they're going to be tachycardic, which means high heart rate, low blood pressure. That is normal to be expected. But I wouldn't really follow it. Have you attended any assisted suicide, meaning end of life? Yeah. So, medical aid in dying. I live in California where it is legal, and I have attended two or three. Now, I've heard of many, but I've only attended two or three, and I'm all for it, obviously. Can you go into the flexibility that hospice nurses have working full time? Will be able to take my kids to school. Okay, so if you're going to work full time in hospice, you probably could take your kids to school depending on how early it is. If it's early enough, like 7:30, yes. If it's like 9:30, maybe not. Probably not. I guess you could be getting your day started really early, really late. There is a lot of flexibility in hospice. I would recommend if you can do it, I would work hospice per diem, but then work full-time hours. So work at a big organization that will need you all the time, almost full-time hours. But then because you're per diem, you're not going to get on call usually, and you will be able to kind of come and go as you please as far as like hours worked. So some weeks you can work 40, some weeks you can work 32, some weeks you can take off. Usually end up getting paid more, but you will have to pay for your own insurance. If you don't think that's an option for you, working full time would work. There's definitely some flexibility, but you'll have to be willing to like stay late, chart at night, things like that. So it can still feel stressful. Welcome, everybody. Come on in. Hospice Nurse Julie, in case you don't know, I am live at 5 every Thursday, 5 p.m. Pacific Standard Time on YouTube. Now, today is Friday because I couldn't go live yesterday because I was out of town. So this is a one off, but I'm glad to see everybody here. And I love seeing people in the chat. It's a great community over here. Um, do psychopaths see dead loved ones die peaceful deaths? I definitely have seen people. I mean, I don't know if they've been diagnosed psychopaths, but I definitely have had patients who gave a very, very, very bad vibe. Of course, we still provided great care, and they did die peacefully. Now, they didn't see dead loved ones or anything, which doesn't mean anything. Many people don't see dead relatives at the end of life. But yes, I've seen people who seem like there is something wrong with them psychologically still have peaceful deaths. Yes. Thank you, Robin of Elves. Do you see a high turnover rate with hospice nurses? Not necessarily. Oh my gosh, it is Friday the 13th. I don't see a high turnover rate with hospice nurses. Um, Depends on the company though. Some companies are worse than others. Welcome everybody over on TikTok. Hi there. You can listen along if you'd like. I'm answering questions over on YouTube, but I'm here and hopefully I'm streaming on TikTok and hopefully you can get some great answers just through listening. If not, it's the same name on YouTube, Hospice Nurse Julie. Hi everybody. Just Brandy. What's up? Fellow hospice nurse. That's amazing. Welcome on in, you guys. Ask your questions. Keep asking questions. If I didn't answer your question, please just type in the chat like in all caps. It'll help me see it. How do you get a hospice degree? Well, you have to. So, hospice employs many people. They employ doctors, nurses, chaplains, social workers, CNAs. So, you'd have to get a degree in one of those things: theology, social work, nursing, become a physician, CNA. There's also hospice volunteers if you're willing to volunteer. That's a great way to do it. But you don't get a hospice degree. I think a lot of times people think like hospice nurses like aren't real nurses. Usually, hospice nurses are experienced nurses who just need to get out of the hospital because the hospital is horrific. John, I did not see your question, but you can ask it again. What do you do when the facility tries to deflect everything to the hospice company? Yeah, that can be tough. So a lot of times people in facilities will have people who live in facilities will also have a hospice on board. And yeah, a lot of times we go back and forth with with facilities because facilities want to blame us for something. The family gets mad. We usually try to have a family meeting if that starts happening with the facility and the family and us, so we can all get on the same page and stop pointing fingers. And I usually just try to like really kill them with kindness and be like, listen, guys, like, what can I do here? Like, what do I need to do to make you guys be okay? Question: have you ever witnessed someone talk after the death rattle began? No. No, I haven't. But people definitely can still have somewhat of like a gurgling noise, specifically if they're like really wet, meaning like they have some kind of heart condition and they just came from the hospital and they were fluid overloaded, so they're really congested. So it's not a true death rattle. They usually are just fluid overloaded and they can have like a gurgly voice and they can try to talk. So I have heard people talk with something that sounds like the death rattle. And the death rattle can be confused with like just the inability to clear your throat because you have weak muscles. So a lot of times that can be confused. The death rattle is only when. Are there Filipino nurses, hospice nurses out there? Yes. And I work with them. uh, Often people will confuse the death rattle is only happening if the person is very, very, very end of life and they have all the other end of life symptoms like changes in breathing, fully unconscious, haven't been eating and drinking. So that's the only time it's the true like terminal secretions death rattle. If you hear it any other time, it's not that. If that makes sense. My son let me know he was okay when he died of cancer 7 months ago. Do you believe this? I do believe in this. I believe in it very much. And that's happened to me as well with my people who have died who I know. Do you feel like late referrals keep patients and families from receiving full benefit of hospice? Yes. Oh my gosh. Late referrals to hospice. This is all we're dealing with. That's why all of us are out here trying to educate about hospice. It doesn't have to be like this last resort thing. Um, and we really need to erase that stigma and it starts in the hospitals, but we just need to take it's just going to take time, and our medical system needs to change. People don't have the time, really. Doctors and nurses in the hospital don't have time to listen to us and get educated for the most part. It's just hard, but we're slowly and surely doing it. Bonnie, thank you. Just retired from the state. I always enjoyed working in hospice. I would love to find a part-time job with hospice, but they don't hire LPNs. Many of them do. I don't know if that's just your. I would look around and maybe that's just in your state, but in California we hire LPNs. How can you tell if someone has been unresponsive for 3 months, stroke, need their tube feed removed, near end of life? Chrissy, so unfortunately, this is like I wish I could answer this question. So a lot of people need to talk to the doctors and nurses that are working with their loved ones. So it would be like unethical of me to sit here and try to act like I can truly answer a question on whether someone should stop tube feed or get it removed if they're end of life, things like that. Generally speaking, I think anyone that has a stroke that needed a tube feed and now continues to have pneumonia and dysphagia and aspiration pneumonia, I think we should start talking about end of life. But I don't know the whole entire case, right? So in order for me to really sit here and give my opinion would be like completely unethical. I don't know anything else about the patient. So if you are close with this person, you need to talk to their doctor and their family and their nurse to say next step, when is it time? Let them know that if you're close with this person, let them know like you're open to it. So it's too hard to know. And it would be wrong of me to sit here and try to say for sure it's time or yes you should do this. Everyone's different. I mean, personally, I would have to know like the length of the case. And really I can't really give medical advice. Not really, not I can't really. I can't at all. I can't give medical advice online. Nor should anyone listen. Hear this? Hear this. Nor should anyone be getting medical advice from someone online. Talk to a doctor in person that's your doctor. Stuff that we talk about online as healthcare professionals who educate online is just generally speaking, general knowledge. Question: is there anything I can put on open wound? She has a lot of pain, especially on her buttocks. For pain, I would say keep someone moving as much as they can. So turn them as often as possible, relieve the pressure as often as possible. And I would have to see the wound to know what to put on it. So if you're working with a nurse, talk to a nurse. Now, a lot of times in hospice at end of life, no matter what you do, because their nutrition's bad, skin is an organ, the skin is shutting down just like anything else on the body. No matter what you do, it might break down. So we always want to keep the wound free of infection, not to heal. The wound will likely not heal. So as long as it's free of infection, we're okay. As far as the pain, talk to your hospice worker or your doctors about either pain medicine and or moving your loved one frequently to offset the pressure on where the wound is. Hope that makes sense. Let's see here. I'm just looking through the questions. Bonnie, did you know that I'm from Erie? Bonnie says, I'm from Erie County. Maybe they hire LPNs now, but I've been looking for some job sites and haven't found any hiring LPNs. Weird, Bonnie. I don't know. I could have sworn they would. But Bonnie, I'm from Erie. I'm from Harbor Creek. Did you know this? Did you know this? Welcome, everybody. Come on in. I'm Hospice Nurse Julie. In case you don't know, I usually go live at 5 Pacific Standard Time every Thursday on YouTube. So if you're listening on TikTok, hi, everybody. I'm streaming on TikTok. I'm not answering questions today on TikTok, but I am live at 5 on YouTube every Thursday. Now, I know today is Friday, and it's because I had to miss yesterday because I was out of town. Where was I at, you ask? Nevada City, California. I recommend to all people. Okay. Nevada City, California is amazing. Anyone on here who is saying like, thank you for your help or telling me their situation about their loved one who they're caring for. I see you. I'm just not reading your question. I'm just not reading what you're saying, but I see you. I hear you. This is a great community. Please join us every Thursday at 5 because you're going to find your people here to give you support. Do you feel you get enough time with patients or do you wish you could spend more time with them? Now, I personally do because I am a unionized nurse with for a company that has unionized nurses. So we only have to see 4 patients a day. And that makes it easy for us to spend more time with them. I'm also per diem, so that also helps. So I feel personally like I could. Now, before when I worked for a non-union company and I worked full time, definitely didn't feel like I had enough time. Thank you, Denny. Welcome, everybody. Alicia, I'm glad you're here. What do I think happens after you die? I think we go to a place that feels more like home than here ever could. I do know it's just my belief, but just from my experience and my experiences with something that I would call God, I just feel like I'm going to wake up there and be like, oh, finally how could I have ever forgotten about this place? I'm so happy to be home. That's what I think it'll be like. And I think it's like that for everybody. Thank Andrea or Audrey. I can't pronounce names. Thank you, Audrey. Do you consider Cuomo in last stages of lung cancer a way of letting a patient? I don't know what that is. Would you consider QUIMO? I don't know what that is. In last stage of lung cancer, a way of letting a patient pass without pain. I don't know what that is. Can you explain what that is? QUIMO. Welcome, everybody. Come on in. Just looking through. Oh, chemo. Would you consider chemo in the last stages of lung cancer away? Sometimes chemo can be a palliative thing. So if it's palliative, sometimes radiation and chemo can be a palliative thing where it actually helps with tumor burden and it does help with pain. In that case, then yes, and even hospice would allow that, but very rarely is that the case. So if someone is truly end of life, um, I would say chemo will just hurt them and not help them. In many cases, it causes them to die sooner. But again, this is case by case basis. Don't just listen to a nurse online. Talk to your doctor. No, it's very specific and it depends. I don't feel COVID affecting our work. No, we do all still wear masks and stuff just for our patients' protection, but I haven't noticed it on a rise, but that could be very true. A lot of times you see stuff like that in the hospitals more because they're receiving patients from the outside coming in with COVID symptoms or severe flu symptoms and N1H1 symptoms. But we don't see that a lot on hospice. Thanks, Joanne. Hi, Julie. Can you explain how active dying end of life works when a patient has a pacemaker? Yes, Wendy, great question. So, a pacemaker does not um, cause any issues at the end of life. So, it runs off our heart's electricity. Once our heart stops beating, the pacemaker will stop. So, the pacemaker does not continue going and keeping someone alive. So, you don't have to worry about it. Now, if it's a pacemaker and defibrillator, which means it'll shock someone's heart if it goes into an irregular rhythm, then you most likely want to have that defibrillator turned off because every once in a while, not always, but every once in a while, when someone is getting towards the end of life, their heart will go into a weird heart rhythm. And if they have a defibrillator, it'll shock them. So we don't want that. So we'd want to get it turned off before you go on hospice. But pacemaker, okay. Hey, Michelle. A member of Compassionate Companions, Michelle's here. Woo, woo, woo. Thank you for being here. Does how does someone qualify for hospice? Do you need two MD's opinions? No, you just need one MD opinion. And really, you don't need, now that I think about it, you don't really need any MD opinion. You can technically self refer, but you do have to have a terminal diagnosis, and people who are expertise in hospice will know if you are terminal or not. Now, usually, someone does get a medical doctor to say, hey, we think this is terminal. But you could not just, let's just say someone has like some kind of chronic illness and they're like, I'm sick of this. I want to go on hospice. You will likely not meet criteria to go on hospice because you have to have a terminal diagnosis with less than 6 months to live. And yes, our hospice doctors can verify that. They can be the ones to say, yes, you are, and have you sign up. But usually it's a doctor that says, yes, you are. And then they refer you to a hospice. So people who always say like hospice is just trying to kill people, blah 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 blah. There are so many regulations and so many things we have to follow per Medicare guidelines. So yeah, you have to qualify by having less than 6 months to live, and that's determined per disease. Welcome everybody. Does bowel movements get affected by appetite? So people should still be having bowel movements whether they're eating or not. They should be having at least a bowel movement like every couple days. And if they're not, we should be giving them suppositories and things to make sure they have regular bowel movements because that can cause agitation and discomfort. Even if they're not eating, their bowels will still be sloughing off a bit and causing at least some waste. So whether you have an appetite or not, you still should be having bowel movements. But yes, you can definitely get uh, your your bowels can become hypo, meaning like they're not really moving that much because they're not working that much and you're not moving that much. So constipation or less bowel movements is a normal thing, but you shouldn't have no bowel movements. Oh, Michelle, I'm so sorry. That is horrendous. My husband was on hospice. He was 58, no diagnosis. Doctor wrote on death certificate, adult failure to thrive. What does that mean? I would have to know his history. I'd have to know his history. So, in order for him to be on hospice, there had to be something going on. So, whether it's like cardiovascular disease, or if he had a stroke, or if he had dementia, or if he had something where he couldn't eat, there had to be something going on. Um, And then failure to thrive is something that, you would never we can't take patients on failure to thrive. That is something doctors will put on there if they're not hospice doctors because they don't know. Um, but technically there had to be some kind of diagnosis. So again, I'd have to like know more than that. There can't be like nothing going on for nothing to for failure to thrive. So I don't know if there was some kind of like cardiac arrest, respiratory arrest, if there were chronic illnesses involved, something. My hair looks great. Thank you. Thank you, Robert. Hi from New Zealand. Saturday afternoon here and stinking hot, 30 degrees. Wow. Hope your Friday's going well. That's amazing, Robert. We're worldwide today, guys. Thank you so much. What would cause a person to choose VSED instead of care given on hospice? So VSED is voluntarily stopping eating and drinking. You can do VSED and be on hospice, so you can do both. I don't know why they wouldn't do both. They must have probably had a doctor involved that was able to give them comfort medication. So VSED is when you just voluntarily stop eating and drinking, so you to hasten your death. You are legally allowed to do this in all 50 states in America. So let's say you got diagnosed with something like dementia. Now, with dementia, you don't meet criteria to get medical aid in dying because by the time you have 6 months left to live, you can't cognitively say you want it. But you could end your life early by voluntarily stopping eating and drinking. Now, you do cut your life short, but you don't have to live with dementia. So people do that. Um, and people do that without a terminal illness. So let's say they have, I mean, MS can be a terminal illness, but you can live a very long time with MS. But some people will say, no, I don't want to. After a while with MS, I'm just giving one example. There's many, but with MS, people will say, I'm done. I don't want to do this and they can voluntarily stop eating and drinking. Now, I would always suggest you getting a doctor involved and getting a hospice involved. So once you choose to do VSED, you would likely qualify for hospice. So they can help you with symptoms because you do have some hunger and thirst symptoms because your body is not technically dying yet. So at first, you may have some hunger and thirst symptoms. I try to educate about it a lot. For some reason, whenever I make videos about VSED, they never do very well. But I think it's a really interesting topic, and I think more people should do it, or should, not should, but I think more people need to know it's an option, and they may be able to do it if they choose. I've been on YouTube for I don't know 2 or 3 years. Hmm. Welcome everybody. Come on in. Do people get to have their pet in hospice when they're dying? So the patients I care for don't go to a hospice place. They stay in their home and we come to them. So yes. Now, if you go to a hospice place, I'm sure hospice facilities are different everywhere. So maybe some would say yes, some would say no, some would say there's visiting hours. It's hard to know, but I think that would be important. Thank you, Margie. If a patient only has Medicaid, Medicare, is hospice covered? Yes, because fun fact, hospice is through Medicare. So it's 100% covered. No hospice company is private pay. No hospice company is private pay. They're either getting money through Medicare, money through your insurance, or they are doing it like they're getting donations or something. They're never making people pay. Unless maybe you're like VIP or something and then you have your own personal doctor and stuff, that could be happening, but that's only a few of us, unfortunately, which is a whole nother YouTube channel we could talk about. Why does the insurance stop paying for Part D meds when you join hospice? Great question. I don't know. I don't know. I think a lot of meds that Part D is covered on. So a lot of times on hospice, people look at it as like, you just go on hospice and they stop all meds because no one cares because you're dying. It's not really true. We really try to relieve like the pill burden. A lot of the meds that you have been taking are only effective like really long term and they have side effects. So if they're not really helping you, a lot of times we're like, it's not worth taking it. It's not worth taking these. And then there's the risk benefit of like something like Coumadin or like your insulin. Now, if you're type 1 diabetic, different story, but like a lot of times the risk of staying on the medicine is too high than the benefit of it. So then we say you should come off too. So, but I mean, at the end of the day, it's probably about money. It's probably about money. I think there's some truth to it. And I know, like I said, like I know healthcare workers like me and the people I work with and doctors I work with, we are not in it for money. We are in it because we care, but we work within a system that's for profit. And it's hard and it's disheartening. Julie, I'm trying to donate my husband's hospital bed, wheelchair, walker. Surprisingly, it isn't easy. Do you have any suggestions? Michelle, I'm very surprised they didn't come and pick up the hospital bed, walker, and things like that. However, maybe you bought it yourself. I do find that kind of surprising. I would call all of your local charities, see if they would take it. You probably have already done that. Maybe a local church. I would put it on Facebook Marketplace. That's what I would do, Facebook Marketplace. If you've already tried churches, Salvation Armies, Goodwills, any medical supply stores, maybe talk to hospices in your area. Can you explain how lactulose and ammonia work? So people who have end-stage liver disease of any kind, whether it's due to alcohol or non-alcoholic liver disease or liver cancer or any kind of metastatic cancer to the liver, if your liver starts failing, you start getting a lot of ammonia. And ammonia makes you goofy and makes you confused and make you kind of like you're not really home. So we start you on something called lactulose. And lactulose you drink. It's like this sugary drink. It's really gross. Usually like 2 to 3 times a day. And the lactulose binds to the ammonia in your body. And then when you poop, because lactulose makes you poop it out. And it kind of clears you up a little bit. So it helps with that confusion. But the downside is you poop a lot because lactulose is also a laxative. Welcome, everybody. Okay, listen, I'm going to have to go in 2 minutes, so I'm going to say goodbye. Okay, so listen, you guys, I love you. Thank you so much for being here with me. I'm going to be back now next Thursday. Whatever the Thursday is right before the holiday, I won't be here. But after that, it'll be Thursdays, 5 p.m. Pacific Standard Time. YouTube will be here. It's free. Come ask your questions here. Okay. I love you guys. TikTok, I'm going to talk to you in a second. Hold on. And I love you guys. Thanks for joining in. Thanks for your questions. And keep supporting each other. I really appreciate your support. Okay. Bye.